I want to bring in my friend Congressman Tom MacArthur, who does an outstanding job representing his constituents in Washington. Good morning, Congressman. How are you?
Good morning, Bill.
How you doing? You good?
I'm doing good. I'm back here in D.C. this week.
Well, I'm glad you came back on because I guess it was last week we were supposed to talk about the good news as far as what was happening with the Office of National Drug Control Policy and Ocean County and your efforts in this war against addiction. So I'm glad you came back on because I wanted to give you time to talk about the good news and how it's going to impact families in the Garden State.
Well, Bill, I really appreciate it. It's a bit of a ray of hope in a very tough situation. Everybody listening knows we have a major drug crisis, not only in the country, but especially in South Jersey. And I started working last year with the Office of National Drug Control Policy to try to get, and others have been working on this too, we've been trying to get Ocean County designated as what's called a HIDTA, HIDTA, high-intensity drug trafficking area. Mm-hmm. And what that allows us to get access to is a DEA office in South Jersey, some more resource, some more money. And our law enforcement officers really, really need this help and coordination. So it was moving along, and then unfortunately, some months ago, the administration zeroed out the entire budget for HIDTA and the Office of National Drug Control Policy. It was like $350 million. And I went back to the Director of Office and Management Budget, who's a friend of mine, and said to him that you can't be serious about combating addiction if you wipe out the only federal entity that coordinates all of it.
Yeah.
And that was the first step. We got the budget restored completely, which was really good news. And then just a few weeks ago, we got our designation as a high-intensity drug trafficking area. And
what does that mean? What does that mean to the average person, the mom and dad who are listening now, or the kid who's struggling themselves? What does it mean that it's a high-intensity drug trafficking area? What does it mean for resources?
First, unfortunately, it means we have a real problem in Ocean County, especially centered around Toms River. That's the bad news, but that's reality. It means that these drug traffickers who are coming down from the cities in northern New Jersey because they think it's open season in Ocean County, they are now going to have DEA resources helping us to combat that. And they're not getting a free pass. We're going to go after them. We're going to get the drugs off the street, and we're going to get the dealers off the street. And that's what this designation will help us with. It's like sending more troops and more weapons to to the front line, and we desperately need the help, and that's what this will mean to us.
Almost 200 people died in Ocean County last year, I understand, from overdose.
Bill, it's every 43 hours.
Yeah, it's a crisis.
I mean, literally every other day we're losing somebody, and there's some good news in the fight. Prescription drugs are the prescribing is coming down a little bit. There's evidence of that. And that's where most people get addicted. People are not getting addicted to heroin on the streets. They're getting addicted in their medicine cabinet. And they get addicted with legal drugs, and then, then they feed that addiction illegally. And so
do you agree, Tom, that you and I have talked about this, and I think it's an important point that there has to be a component of us really digging deep with families and teachers even, and talking about coping skills and helping people overcome adversity and quite honestly dealing with pain. Because when I hear people getting addicted on prescription drugs, it sounds to me like there's just an easy way to say, wow, there's a pill for that. There's an app for that, and there's a pill for that. And to me, that is the driver that I find a lot of these kids coming out of school, they don't possess the coping skills. They're not prepared to deal with life's adversity, whether it's physical pain or mental anguish or just suffering a loss of a job. I mean, and I don't see that being addressed. Is that something that can be worked on from a government level?
Well, I think we have to work at it from every level. And you're right. You highlight two really critical points. One is that we need to work with children and help them cope, help them learn that life has some pain in it, and you can't just take a pill always to make it go away. Yeah. It's how I lost one of my closest friends. He lost his job, and He started trying to ease the pain, and 6 years later, he was dead.
Yeah, God forbid.
And it's just devastating. And the other thing is that the medical community defined, I don't remember when, maybe a decade ago, defined pain as a vital sign. And they began to measure it, and doctors are judged harshly under the Affordable Care Act if they don't alleviate a patient's pain. That's been part of the problem with this epidemic, is doctors are just prescribing too much and too quickly. I just co-sponsored legislation yesterday, or just announced that we went out with this yesterday, and it would put a federal limit of 10 days on new prescriptions. Doesn't override the state, like New Jersey has a shorter limit, which I support, but this would at least apply a federal limit so that doctors begin to get a grip on this issue of overprescribing.
All right. Well, Congressman, I applaud your efforts. I think this is a good first step. And I think in terms of prioritization of federal money coming back into New Jersey, I like to see dollars coming back that are going to empower law enforcement to help make changes on the ground, because this is a local issue that has to be solved locally. And certainly we don't have the budget for it in New Jersey. So I think that what you're doing to bring those dollars back are absolutely critical. And I want to thank you again for your courage and your foresight and your determination. You're just, you're like a guy going through a brick wall, and you're doing it. So thank you for that.
It has to be done. I do want to say to listeners, Bill, I take this seriously. I chair the Bipartisan Heroin Task Force in Congress, and we do have on our website a resource guide. If a listener or a loved one of a listener is struggling with addiction, please take a look at the website. There is help available, and there's some really, really terrific organizations.
This is on your congressional website?
Yeah. Yes.
Okay.
Yeah.
I will link that to my page.
And there's organizations like Hope Sheds Light in Ocean County. My friend runs a Maximilian Foundation, which is actually doing exactly what you suggested. They're trying to help kids early. There's some great organizations that are really trying to help address this issue.
Thank you, Congressman. Listen, I have to jump. Can you do me a favor? I got a break for traffic weather. Can you just give those organizations to Chris real quick? He'll just jump back on the line, because I want to list those and have some of those guys on as guests.
That'd be great.
Awesome. Thank you, Congressman. Appreciate your time. All right, it's Congressman Tom MacArthur. It's